and is our correspondent at the Sheikh Shehzad camp. Azmat, talk about extensively visiting the health facility that is available here. Talk to me about that.
Well, we're seeing many different organizations functioning here, different assistants, whether they be NGO or government or even Army. Today was the first day of the operation of an Army field camp hospital, which can serve up to 1,200 to 1,500 people per day. That's a significant amount of people for both of these camps. It serves Sheikh Shehzad camp as well as Sheikh Yassin camp, which has a combined total of around 20,000 IDPs. And this particular field hospital had ENT specialists, eye specialists, skin specialists. It had x-ray machines, it had surgery operations, so quite sophisticated technology offered to those people who are here at this camp. Additionally, there are NGOs present, a British NGO by the name of Merlin. You'll be talking to one of the leaders, it's one of the leading doctors at that NGO, Dr. Anwar Jamal, in just a little bit.
Yeah. But before that, you're going to talk to me about, briefly about the psychological aspects of the IDPs that are present, because that is very important.
Absolutely. These people are fleeing areas where they've undergone much trauma, whether that be violence on the hands of the Taliban or whether it just be the separation of families and whatnot. We're seeing a lot of people depressed, dealing with post-traumatic stress disorder, and traditionally these sorts of issues have not been stressed upon strongly in rapid onset emergencies like this, these disaster or crisis situations. But what we did see today were several psychologists functioning in this area, providing medicine and also doing alternative sorts of psychotherapy, including deep breathing exercises, art therapy for young children. We saw many young children drawing and painting, which was relaxing for them, as well as stretching exercises, in addition to a host of other psychosocial.
Of course, Azmat, we've seen lots of families there. We know that women and children are here. Did you see anything happening on the gender-sensitive health services front?
Absolutely. We saw lady health workers and doctors. Now, lady health workers are not female doctors. They are women who have been trained specifically to care for the health of women. This is a program that started just a few years ago and has really helped women, many of whom do not feel comfortable seeing male doctors.
Right.
So that has been a progressive step.
Let's have Dr. Anwar Jamal with us. You were mentioning him earlier. Thank you very much, Dr. Anwar Jamal. Could you tell us briefly about your presence here at the camp? What do you represent?
I'm representing Merlin. It's a UK-based NGO that responds worldwide to disasters, which is man-made or God-gifted. We are specialists in health sector, in the relief operations. Regarding the IDPs in this district in Peshawar, we are working in IDPs since September last year. And in the recent influx, we are here in Sheikh Shehzad with a primary healthcare facility.
Okay, so is your, to clarify this a little, is your NGO providing medicines to the IDPs on a day-to-day basis?
Of course, we are providing services 24/7 with the referral and ambulance services.
What are some of the problems that the people are facing here?
Infections of the upper respiratory tract infection, diarrhea, simple diarrhea, and scabies, like the skin infection.
What could be the reasons for these diseases here?
Actually, the weather condition, this is not like that of the, you can say that the area from where they came here in these camps is not like this in the hot weather and the
There's
dusty,
a change of weather for the IDPs.
Change in weather and the dusty condition in the camp environment. They are living in the tents, so that's the main cause of the upper respiratory tract infections, and we are facing a lot of cases of these.
Okay, could you talk to me about certain vaccines, because we know that snake bites could also occur because people are sleeping out in the open on chatais. So do you think any specific vaccines are required?
Yeah. This specific vaccine is called anti-snake venom, and this is already available at the DHQ and Merlin Medical Complex capacity. Just we trained our doctors which are present and women medical officer in our clinic, Merlin Primary Healthcare Service, to treat the basic and then refer it to the...
Dr. Jamal, very briefly, if you could tell me, how long does your NGO plan to stay here in the IDP?
In the recent scenario, we will be till the end of the last tent. We will be here till December. We have planned and we have fund for that to provide services to the community. Yes.
Okay. Right. Thank you very much, Dr. Jamal, for taking out time and speaking to us here on Express.
You are welcome. Thank you.
That was Dr. Anwar Jamal. He was representing a British NGO which is helping the government out in providing, in ensuring some kind of adequate health facility to the internally displaced people. And now, the visit by Pakistan's army chief in the